Hello everyone, I'm Dr. Mark LeMay and welcome to this week's edition of the Wellness Connection. We have a special guest with you here, Professor Kerry Bone, all the way from Australia. And so we wanted to just kind of give you an idea of what are his credentials. Okay, so Professor Kerry Bone is a practicing herbalist, co-founder and head of research and development at MediHerb, and principal of the Australian College of Phytotherapy, working for the Australian College of Phytotherapy and in conjunction with the University of New England. Kerry has also developed a master's degree program in clinical herbal medicine. In relation to his work, he was appointed associate professor by the university from 2006 to 2012. Kerry was also recently appointed the adjunct professor at New York Chiropractic College. So, Kerry, welcome to our program here today. And I got a question for you. One of the biggest things I hear all the time in practice is that herbs are not safe for us. Could you address that issue?
Well, I think fundamentally it's propaganda, isn't it? Because herbs are safe, and I've now been in continuous practice for 34 years. Now, there are rules you have to follow, issues like herb-drug interaction, safety in pregnancy, and such. But having been in practice for 34 years, I have to say I have never had a serious adverse event in my practice. But I think it underlies a very important consideration, and that is if you want to take herbs, you should get them from someone who's trained, from a clinician who knows what you need and knows what you're taking in terms of the drugs and knows what's safe to give you. So you need expert advice, and as long as you're taking herbs under expert advice, and importantly, using high-quality products.
Yes.
Because adulteration is often responsible for many of the safety issues. As long as you're doing that, then herbs are incredibly safe, almost amazingly safe.
And again, it's really interesting that you say that too, because I hear from other practitioners like, well, there's really no research about herbs as far as their safety and their clinical application and how effective they are. Is that true?
There's an abundant research on herbs, both in terms of their quality, safety, and efficacy. In fact, I have trouble keeping up with it now. And honestly, it takes me several hours every week just to review what's being published in the field. So this is a very actively researched field now, and we're generating high-level evidence. And indeed, we can think of examples like disease modification in osteoarthritis and helping hit many targets, for example, in people with poor immunity, how herbs fulfill a role that you just can't fulfill with drugs.
Yeah, and that's exactly what I see in practice too, because I've been using a lot of the herbal preparations from MediHerb and getting very good results with those. So speaking of that, as far as results, could you give us like a case history or like a case study that you've done with somebody recently, like with herbal practice and kind of the outcome that you've gotten?
Yes, absolutely. And when I set out on my herbal journey, if you like, I set myself a fairly simple task, and that was to make a significant difference. A difference that possibly could save a person's life in someone's health that was genuinely attributable to the herbs. And the case I'm thinking of, exemplifies that perfectly. This is a patient with chronic kidney disease. He had a GFR, which is a measure of kidney function, in the mid to low 20s. Now, normal kidney function is 60 or 70 or higher. So what I did was I put him on echinacea for his immune support, because there were some autoimmune aspects to it. I also gave him a protocol for his microcirculation, which is a dietary protocol that included things like bilberry, cocoa, garlic, green tea in his diet. And then also I gave him a microcirculation herbal product, which had gotu kola, ginkgo, and grapeseed in it. So his kidney specialist said to him, you'll be on dialysis in 2 years. Mm-hmm. Your trajectory is very low, and once you get into the 20s, I've never seen it reverse. So 2 years later, that patient's GFR was normal in the 70s. And now another 5 years after that, he still keeps on the herbal regime, but his GFR is still completely normal.
And that is a great way to just say that herbal preparations, good high quality herbal preparations, what they can do and what kind of an impact they can make on patients. And just so you know, Professor Bone, I totally agree with you, because I've been using them now for the last 4 years, and I have seen great results with my patients in different areas too. Not like the one you just told me about, but I have seen really great results with my patients too. So thank you very much, because he is one busy guy. And we're just so thankful that we got a chance to actually even get you on our show here today. So thank you very much for being a part of our show. And we really appreciate you coming all the way across the pond again to visit us here in California.
It's been a pleasure, and thank you so much for your interest in your work with herbs. I do appreciate it.